हॅलो.
येस मॅम. येस, रोल नंबर 25.
हॅलो.
हा मॅम, आवाज येतोय.
हा, मी पार्थ कानसूरकर नावानी जॉईन केलंय.
हो, केलं मॅम, बघितलं मी.
हा हा. ओके.
येस, रोल नंबर 25.
स्क्रीन दिसतोय सर?
हो, दिसतोय मॅम. येस.
ओके ओके.
Yes, yes, ma'am.
येस, रोल नंबर 25.
Good morning to all.
येस मॅम.
Dr. Suvarna Bhokre from Srinath Kollab Pharmacy, Associate Professor, Chhatrapati Sambhajinagar. Respected respected sir and ma'am, distinguished guests, respected faculty members, and dear members, it gives me immense pleasure to introduce our esteemed speaker for today's session, Dr. Shubhada Lohiya ma'am. Dr. Rathi Lohiya ma'am completed her MBBS for SRTR Medical College, Ambejogai, and MD in Medicine from the Government Medical College, Aurangabad. She has received specialized study eco training from MMC Chennai with more than 30 years of rich clinical experience. She is renowned cardiologist and diabetologist practicing in Ambejogai since 1995 and is currently the director and consultant physician at the Asha ICU Ambejogai. Dr. Lohiya has made a significant contribution to the medical profession as an academician and organizer. She has served as the secretary of IMA Yogeshwari branch Ambejogai and has been organizing committee members for prestigious conferences such as the Maraficon. She has organized and contributed to several CME programs and workshops on critical care and mechanical ventilation, and has also worked as an examiner and chairmanship at the national and state level medical conferences. Beyond her clinical excellence, Dr. Lohiya is also a distinguished author and translator. She has translated internationally acclaimed books such as The Law, Medicine and Miracles and Pandemic Journals into the Marathi, as well as has authorized to the well-known books uh, Raghunanchaya Chashmayatun, focusing on the
रुग्णांच्या
patient relationship. She has actively conducted health awareness lectures, medical camps, and community outreach programs in both rural and urban areas. In recognition of her remarkable services to the society and the medical fraternity, she was honored with the Arogya Bhushan Puraskar 2023 by the Maheshwari Mandal Bid. She is also deeply involved in the environmental conservation activities, plantations drives, and educational initiatives for the children through the Avishkar Shibits. Today, we are truly privileged to have Dr. Shubhada Rathi Lohiya ma'am with us to share her valuable insights on on our FDP training programs. Her experience and knowledge will be certainly inspire on and enrich all of us. Please join ma'am in giving a warm and hardly welcome to our distinct speaker, Dr. Shubhada Rathi Lohiya ma'am. Thank you, ma'am. Please, ma'am, proceed. Please, ma'am. Dice is yours, ma'am.
wait, I'm sharing my PPT. Excuse me.
Yes, yes, ma'am. Sure.
Yeah. Myself, Dr. Shubhada Lohiya. You are already known by Madam. She has elaborated my identity very well. But being in a rural area, we have got some problems of net and all that, and I'm not that much accustomed with sharing my screen. So please wait for 2 minutes. I will be sharing my screen, please.
Yes, ma'am. Yes, yes. No problem.
Yeah. Yes, thank you. my first topic will be related to stress management for teachers and students. Basically, more I will be focusing on students, as I think all the listening persons are teachers and they know it very well. But still, some factors which are not known to everybody, I will try to take in my lecture. Stress management for teachers as well as for students. Why this topic is important? Because nowadays we have seen that many reasons are there to have a stress. There are so many causes. Basically, in students, we are seeing the rate of suicidal attempts are more and all that. So
हॅलो मॅम तुमचा आवाज येत नाही.
me
Hello, ma'am. We cannot hear you.
एक मिनिट ना सर, मॅम नेटवर्क इश्यू आहे शायद. येस मॅम.
या
हा मॅम येतोय आवाज, मॅम फक्त पीपीटी दिसत नाहीये.
आवाज नाही येते का?
आता आवाज येतोय मॅम, फक्त पीपीटी दिसत नाही तुमची.
पीपीटी दिसत नाही. ओके ओके, 1 मिनिट. हॅलो.
हेलो मैम, स्क्रीन नहीं
Screen is not visible. I have already shared my screen. Is it okay now?
हाँ, एक मिनट आता लिसन.
Okay.
Yeah, ma'am, it's visible.
Yes, ma'am, it is visible.
Okay, thank you. So, I have chosen the topic stress management for teachers and students. Now, if we go through this slide, all are taking education because there is a policy that education for all. Really, is it needed to have education to all? Yes, it is definitely needed. But nowadays, what I see in the students, that why they are taking education, so they want a good job. For that purpose they are taking education. Then they want to avoid the work, because I am in a rural area. I have seen that they don't want to go in agricultural land, and that's why, to avoid the laborious work or to avoid the other workload, they want to have a job and have a very stable life, stable salary, monthly salary paying job. So that's why they can avoid their labor work in their own field also. their agriculture field. For that purpose also, they are going to for education. They are taking a degree and they think that they will get proper job with that degree. The further details, they are not knowing what is career, what to do after you are taking a degree, what we want to do. They are not aware of these things, and then they get problems in their future life. Their education is to fulfill their needs. Their needs means they want a good house, they want a good vehicle, they want a school education which is not a government school education. They want a private school, English medium school. Then they want that their children should go to CBSE or ICSC schools, and they should get more and more. For this purpose, they need more and more money, and they are not satisfied with whatever they have. And then they want to have a education to fulfill all these needs. They want to educate. Some people, they are very keen about their interest. They know what they want to do in the future, and they have the policy that they want education to satisfy their interest. Like that, somebody is interested in music, somebody is interested in drawing. Some people, they choose not JEE but architectural entrance exam because they know that they can have a imagination power. And such students, they always are not under the stress. So that is how one can relieve the stress that I wanted to emphasize. So I kept this slide, that education to get stability, to avoid the labor work, to fulfill their needs will become a stressful factor. But education to satisfy our interest will reduce our stress. Education and stress, how it is correlated with each other. So now we have seen, we know everybody that there is entrance examination for every stream, every educational stream. Science stream, it may be science stream, it may be arts, it may be accounts, it may be everything. There everywhere there is entrance exam nowadays, and there is a mismatching in the examination pattern also, means appearing students and the available seats. This is very much difference is there in between these two things, and this mismatching makes the stress more and more to a person. And that is a major cause which I am facing in my OPD regularly. And then I have to counsel them that if you don't get this seat, you can get something else. And like that, their stress has to be reduced. So it is a very big thing that entrance examination are the more major cause of stress. Then uncertainty to get admission, same thing. They want to have a specific course. That while giving a NEET examination, you can get admission to many of the courses, like physiotherapy, like you can teach a dumb and deaf child, you can teach a blind child and all that. But they want the admission to MBBS only. Misguidance and confusion by the private coaching classes. Nowadays, private coaching classes are also having a major role to increase the stress of children. Though a children has got capacity or not, they force the children to have a specific course and appear for the entrance examination. Then after giving examination also, after taking a graduation degree also, there are so many engineers, they come to my OPD, they don't have job, then they go on they go for own business and all that, but they are not satisfied because they are not doing the work whatever they have learned about. Then extended academic period. Now I will take an example of a doctor only, because I am a doctor and I know it very well. Suppose a person, he gives NEET, he's scored his marks properly and he get an admission to the MBBS course in the first attempt only. Then he has to appear for 4.5 years. After that, 1 year internship. After that again he has to appear for an entrance examination, which takes at least 1 year. If he gets regular admission, even then he has to face for 3 years for his post graduation. After that also, he is not that much eligible to practice in the community. And if he wants to practice, if he don't get a government job, then he has to invest much more money for his business, and that is a stressful factor. Even the extended academic period, because of extended academic period, his personal life is also disturbed, and all these factors together act as a stress factors. Even for a CA, the same thing is there. Even in arts, or a musician, or even a English teacher, and everybody can have these problems in their life, because job is not that much easy. Practical knowledge and education, why previously it was very easy, everybody was getting a practical knowledge, but nowadays education is online. More of the more and more education is online because of AI, because of all these digital media. Practical knowledge is gradually lessening, and education without practical knowledge is again a part of stress, because when he goes in his community for his knowledge, then he is stressed. He knows that I can face all these problems, and that can make a stressful life. Increasing competition, we have already discussed about, so I am not going through this. Now, stress related data is there. Many of the people, they are working on the stress factor, and there are so many papers are published in various at various levels. The first paper I will like to put in front of you, that is published in Lancet. Lancet is a journal which is published by medical faculty in London, and very well known and renowned journal it is. It says from 2000 to 2023, the study is done from 2017 to 2023, and they have seen that 1 out of 7 person, it's done, the study is done in a normal person, and they have noticed that say 1 out of 7 person is suffering from some or other mental disorder. Then there was a study done in 31 countries togetherly in 2024. That was the 31 countries were participating in that study, and it was found that 3 out of 5 people have mental disorder from mild to severe. Severity may be low or more, but they are getting 3 out of 5 people are getting mental disorders. It also emphasizes, that study also emphasizes that 66% women are suffering from mental disorder, and 58% of the men are having stress related problems. So both the things are very countable, and we should look this problem very seriously. Otherwise, the problems are increasing, and requirement of psychiatrist will also increase day by day. ICMR study was conducted for the students, specifically for the students, and was published in October 2023. ICMR is a council of medical research, Indian council it is, and it has revealed that 12 to 13% of students are grappling with psychological stress. It was reported that all over the India, 12,500 students died due to suicidal attempts. So it's a very accountable number, that this much of the suicidal attempts have been taken, and they died. These people died. There are more suicidal attempts. The number of died persons we are counting. Then next is estimating the prevalence of stress, again in the Indian students. The same study that showed that 47% students are afraid of something. The fear may be of different things, but he has got fever or she has got fever in 47% of the students. the first step of a mental disorder. Then second step, that can convert, the fear can convert into worries, and the worries are they seen in 65% of the students. Next step is low stress. The worries convert into the lower part of the low stress, and that is 49%, again equivalent to fear. Manje, we can see that 47 in 49, it is as good as the fear converts into the low stress. This low stress again converts into mild stress, that is seen in 45% of the students. So it's a very big number to be considered always, and should be considered, I think. And the higher stress is seen in 6%, though it is less nowadays at present, or the study is from 2023. It has been increased in last 2 years, definitely. The recent study I could not get, so I have put up this 2023 ICMR study. Then what are the factors that are affecting stress? This study was done in 2022. They are afraid of their future. What will happen in my future? I already discussed few factors, but afraid of future for everything, their job, their education and all that thing, children's, their life and all that, they are afraid of. So I think this is a considerable factor. They should not get fear of their future. For that, counseling is required. Current work for teachers, this is very much important. While they are working in their um, while they are working with their own institute, they have got a stress of different type. Now I have seen many of the colleges, they have to document so many things. If they have taken a camp, they have to online, they should go get a notice that it is done, and they want to take photo, they want to document it, and they want to send to the various levels of the institutes, and then they get their marks. So that is also a very big thing for making stress. Stress about achieving goals is 3%. As compared to other factors, it is comparatively less, but it may increase day by day as entrance exams and they having their own choices. It will increase day by day. Inadequate sleep is a 6%. Still, it is lower in this study. But whatever I see in my practice is that I'm saying that in my practice, the people they come, they don't have sleep proper. They say that even in 8th class, the person is saying that I will be sleeping at midnight or 1 a.m., 2 a.m. And he woke up in the morning for the school. So he is not getting proper sleep. What he is doing, he is studying, or he is online on the media, digital gadgets, I don't know. But what they report us, that is, they are studying till night, and this inadequate sleep will definitely increase your stress. Relationship troubles, we all know that relationship, if it is not fair, then we get a stress. What somebody will say about our personality, everything, what our views for a proper. Then health issues. Somebody may have health issues and he may get an financial instability, and other factors are also responsible for the same, for increasing stress. Now, these are the factors which causes the stress. Now I will go through the factors which will reduce the stress. The first of all is everyone should express whatever they want to express. Having proper communication and dialogue is a very important thing. Munshi Premchand is a writer from Hindi language. And
the
he says that expression is human's inherent quality. And now, if we suppress this quality, then definitely a person will get stress. So, expressions, communication with somebody in your life is very, very important. And one should have at least one friend to whom you can express your all the problems or whatever, your joy also one should express. If you are not expressing your joy or your problems or your uh, everything whatever you want to share is not shared, then definitely stress will be there. So try to express to somebody whatever you want to express, helping to identify one's own capability to reduce the competition. I have seen one child, engineering student he was. He came to my OPD and I found that he was interested in basically in music. He was a tabla vadak, and he tried to do that since childhood. He was on tabla, but his father wanted that he should get a good quality, a good degree first, and then he will be a tabla vadak. So what he did, he got an admission to an engineering college, but he was not having a capability to go through the engineering course. In the second year only, he could not qualify in the mathematics. He was failed in mathematics, and he tried for 2 to 3 times, and then he failed. When he came to me, he was quite severe depression he had. Then I have to counsel him that you can go for tabla and do all the whatever you want to do. He left his engineering, he went for the tabla classes, and he improved himself with music, and now he is doing very well in his career. So one has to know his own capability, that how he can do whatever he wants to do. So that is a very important, and this could be done by a teacher, this could be done by parents, or him himself. He could manage for the to understand or to identify his own capability. So this is very important to know one's own capability, which should be done by either parents or teachers, and it is very, very important factor in everybody's life. प्रोविजन, गुरु का महत्व हर जगह होता है, तो गुरु इज वेरी इंपॉर्टेंट, और ये गुरु किसी न किसी को बनना चाहिए डेफिनेटली. Provision of proper guidance by teachers and parents, again the same thing. Either teacher himself can guide a student or a parent can guide, and he should give a proper guidance. If a person is not able to do something, ask him to change the field and go through the another whatever his choice is. To develop a hobby is a very important part in reducing the stress. When I'm working in my hospital for 8 to 10 hours, then in early morning when I go to nature and I see the birds, because I am a bird watcher, I have a hobby of bird watching, and when I go for watching the birds in a week or twice a week, then all the stress of my hospital work I get relieved of. And I think that is a very good part to reduce our stress, and that is a very good thing to reduce the stress. And the next thing is to cultivate an art. Art is a very good thing. Art is a science, and science is art, both the things. So if you look in that way, if you cultivate your art, that is a creature in your life, and a creature is definitely a positive thing in your life, and this positivity reduces your stress. So that is a very important part of reducing the stress. Control over mind. One should control their own mind. They should learn to control. जैसे हम कहते हैं, मन के हारे हार है. संत कबीर कहते हैं, मन के हारे हार है, मन के जीते जीत, जो मन पर असवार है, मन ही के प्रतीत. मतलब अगर हम माइंड पे कंट्रोल रखें, हमारा मन अगर हार गया, if our mind thinks that I am defeated, then you are defeated. Your mind thinks that you can win, you can win. That is what the Sant Kabir says, and it is very, very important. Now, this anxiety factor is there, which can go for stress. So, how to relieve this anxiety? If you want to relieve your anxiety, you can do a prayer to relieve the anxiety. When you are going for a lecture, when you are going for a examinations, then what to do? So people, हमारे घर में जो बड़े लोग रहते हैं वो कहते हैं कि आप प्रार्थना कीजिए. तो if you go for a prayer, that prayer will help to calm your mind, and that can reduce your anxiety. Maximum anxiety can be reduced with the prayer, with the counseling. If the anxiety is matlab more stress is there because of anxiety and your anxiety level is higher, then you can get a counseling from a proper counselor or from your doctor, from your parents, from your teachers, from your friend. Anybody can counsel who knows you properly. So counseling is also very important. Express yourself when you have got anxiety. Again, I will say that try to get invested in a art. Try to do exercises. And the best part to relieve your anxiety and depression is डायरी मेंटेनेंस. अगर आप डेली डायरी लिखते हो, that will help to reduce your stress, anxiety and depression as well. When this anxiety and depression increases, it may turn into addiction, and whatever we are seeing today is more and more addiction, even of the different things. I will not go for more details of addiction because it's a separate topic to discuss on addiction. But depression, when it increases, anxiety, when it goes in higher expectation, then definitely it will turn into addiction because you are not able to handle your mind, and then it turns into addiction, and addiction can control your mind. So it becomes an easy thing for a person to be addicted. So I think first it should be handled at the level of anxiety and depression so that one can be relieved from addiction. How to get control? Through meditation and exercise. Meditation and exercise. Meditation, prayer is the first step of the meditation. The next step is meditation. When you prayer, you can concentrate and you can calm your mind. That is what the meditation is. Meditation is focusing on one thing without any other thinking in your mind or other part of the mind to be kept calm, and you should concentrate on one thing. That is what the meditation is. And exercise. Now all these both together, how they help to reduce your stress is scientifically it is proved. Nowadays there are so many papers which are available, and they says that because of meditation and exercise, the cortisol levels of in your blood, they get lessened. They are the stress hormones. If they are more, your anxiety, your depression will increase. So to lower the cortisol levels, meditation and exercise will help. Higher the cortisol levels, more will be the stress. So you should relieve by meditation and exercise. Meditation and exercise also helps to increase your CD4 and T helper cells. These CD4 and T helper cells are our cells which can have reduce your stress and reduce your anxiety too. They fight with your everything in your body. So please try to increase CD4 cells and T helper cells with the meditation and exercise. Then increased telomerase activity. Increased telomerase activity is a activity which is done on DNA. Basically, it is a cell enzyme which can increase your DNA telomerase, and that helps to increase the CD4 cells as well as T helper cells. With the meditation and exercise, we can increase the telomerase activity and then increase the CD4 levels, T helper cells, and that will help to improve your stress. Again, meditation and exercise will help by increasing the neurotransmitters like dopamine, serotonin, and GABA. GABA, that is gamma aminobutyric acid. Now, this gamma aminobutyric acid regulates our brain activity by reducing the neuronal excitability. Why we get anxiety? Because the excitability of the neurons in the frontal bone, in the frontal brain, and that's why it increases the stress. So if it is properly raised in your blood, properly prepared in your blood, and it is released in your blood, so it will help to reduce your anxiety. Meditation and exercise will increase this GABA, and GABA will help to reduce your anxiety. Also, GABA levels, if it is good in amount, that will reduce anxiety indirectly. It will also not produce depression because it will regulate your brain activity and sleep disturbances. GABA is very important to make your sleep properly. It's a vice versa. If your sleep is good, GABA will be good, and GABA is good, your sleep will be good. So both the things are vice versa, connected with each other. And so it is very important to meditate and to exercise so that your sleep is good, so your anxiety is not there. You can reduce your depression, anxiety by sleep maintenance also. And so GABA level is important, which is maintained by meditation and exercise. How much and what type of exercise one should do is a common question in my OPD. But I think it varies from person to person. I should see the person and then should advise, because sedentary lifestyle is there, then exercise has to be increased. If already a person is working more, then the exercise level can be regularized with moderate exercise. So it can vary from person to person. So, but accordingly, you should take a consultation with a physician and then decide what sort of work one should do, exercise one should do, and then they should do the exercise. Then sports and mind. How the sports help to control your mind activity? Sports improves your concentration. You have to focus on something. Every sport is improving your skill, is improving your concentration, because you have to focus on something while you are playing, and that will help for your concentration. Once you have got concentration good, you will have all the enzyme levels good, and then your stress will be reduced. So that's how the sport reduces the stress. It also helps to calm the mind by improving serotonin level. We are already seeing that how the serotonin works in our brain. Serotonin levels, if are normal, proper there, then it will have your mind in a positive state, never will be in a negative state. So good level of serotonin has to be there. Serotonin regulates the brain functioning, that we have already seen. And sport, in addition, it helps to our body as well as mind by relaxing our muscles and reducing the heart rate and blood pressure, so that it helps to calm our body. And body and mind are again connected in a again they are connected. If the body is calm, then your mind will be peaceful, and if your mind is peaceful, your body will be relaxed. So it has to be, they are connected with each other, and such a way they are connected with each other, and they reduce the stress level. Reading is one of the thing that can reduce your stress. Reading means not reading comics or reading something. Reading should be with some thought in that reading, or some stories which can calm your mind, which improves your knowledge. So the reading which can improve your knowledge will definitely help you to reduce your stress, because that helps to improve the writing skills also. For a student or for a teacher, reading can improve the writing skills too. and that helps to reduce the to reduce the stress, because by reading you are aware of your knowledge is upgraded. If your knowledge is upgraded, your confidence is boost up, and because your confidence is boost up, your skills will improve, and your skills improves, then your confidence and all that together will reduce the stress. Reading also helps to improve your cognitive development, to think in a proper way, to think if you want to do something, how the cognition should be done, that can be you can get that skill by reading. And so it is very important to get aware of some skills and all that, and that makes your cognitive development too. It helps reducing thereby stress. So all these together factors helps to reduce your stress. It also helps to get a sound sleep, because sound sleep is also important, that we have already seen. I have seen many patients already, I have mentioned about that. I have seen many students who cannot sleep properly, and so their illness is prolonged, because sound sleep is a very important thing, which I will be discussing in the next topic. So I'm not going much more in the depth here. Sound sleep, how it helps in healing. So definitely it helps for to reduce your stress. Electronic gadgets and media. Media is always a misleading thing, because it may tell you the truth as well as the false things. So media should not be always taken into consideration. I had just few days before, I had gone through a web series that is Thode Dur Thode Paas. It was a very nice web series that was telling that how electronic gadgets has changed your life and relationship too. The family was, there were 5 members in the family, 2 brothers, then one wife one of the brother was married, and they had 2 children. So these 5 members were there in the family. Their grandfather, when appears in the family, he saw that everybody is sitting in their own room and doing whatever they want to do. They are not connected with each other. When their electronic gadgets were taken off, and they become a family, real family. So I like that serial, because electronic gadgets, how it misleads us about that, it was telling in a proper visual and audio media. So definitely it was a very good, and now we should avoid to rely on the electric gadgets how much possible. We can't be of the electronic gadgets, but we should use it whenever it is wanted. FOMO is upcoming new psychological disorder, that is fear of missing out, and that's why many of the people are on the social media for maximum period, that they are aware of everything, they know everything, and they want to show the people, show the community that I am upgraded, I am updated. And then if they are not, they don't get likes on their media, social media, then they have got the fear that I'm missed out, my thinking is not taken in consideration by community. But if we are away from the electronic gadget or media, we will not have FOMO. We can talk with the people, we can mix in the community, and that will help to be away from FOMO. Addiction, again, the same thing. We get an addiction of mobile, we get an addiction of the social media, and that is not good. So it also increases our stress. If we are not considered by people, then it can increase our stress. Because of these electronic gadgets and media, that also disturbs our sleep pattern, because many of the students, many of the teachers, many of the businessmen I have seen in my patients, that they are on the social media after 10 p.m. and they don't know how when to stop this, and then they sleep at 11, 12. Because yesterday only a boy chap came, and he said that I will sleep at 11 a.m., but my mother doesn't sleep. So it's very disturbing. And
इंटरेस्टिंग कारण काम हमने सांगितलेलं असेल की नाही
disturbs sleep pattern. Also, it is ADHD can be there. That is attention deficit hyperactivity disorder. If you are not attended by you, if anybody is not giving attention to you, there is deficit, and then you go on hyperactivities, like you want to attract somebody and then you do something which is not needed in your life. The next is how to get stability of the mind. Get the stability, meditation and yoga is very important. Yoga has got Ashtanga Yoga. Everybody knows, because Yoga Day we celebrate, and yoga nowadays is upcoming very well. People know about it, but if you are not knowing, you can know about it and you can do that regularly. Niyam, asan, pranayam, pratyahar, dhyan, dharana, samadhi. These are the Ashtanga Yoga of yoga. Meditation is dhyan, samadhi, dharana is meditation. Before that, one should go with yam. Yam is for your own body, that is how to behave in your community, yourself how to behave. Niyam is to maintain the community properly, Shuchita, even tap you can do, and all that is yam and niyam. Asanas are very important to maintain your body, to maintain your posture, and that will help to reduce your stress by maintaining the postural and your muscles and joints. Pranayama can control your breathing, and that breathing controlling will help to reduce your stress. And the next thing is like to meditate something, to concentrate on something, that is what is pratyahar, and this pratyahar will help to do meditation, that is dhyan. And the next step is dharana. You can dharan something, means you can do something properly and present it properly. And the last one is samadhi. You are in the community but you are away from the community mentally. So that is what is samadhi. And this will help definitely to reduce your stress. Reading, we have already seen how it helps. Hobby, that also I have quite given the examples. And I have seen many people who have got different types of hobbies, and because of these hobbies, they are happy in their faculty, in their job, in their business. They are very happy because they have got some hobby, either reading, music, drawing, anything. So you can have a very good hobby, even make kitchen making. You can have a hobby of cooking. So these hobbies help you to reduce your stress by getting interest in those activities. Social participation is also very important. You should go to, not all, but whenever you want to be participate in the social activity, you should participate in the social activities, various social activities like marriages, like birthdays. These are the there, and plantation or any social activists are there. They work more there, and if you like it, you can join them. That will also reduce your anxiety, your stress, and it helps to improve your positivity in your life. That helps to improve your confidence, that satisfies your mind by doing such activities, and that helps to reduce the stress. Exercise, we have already seen how it helps in our life, how it helps in our body. Environment and state of mind. Be a part of environment. Never be a part of a compartment. Always we are in a compartment. If we go in nature, you see the two major colors, green and blue. These two colors are present always in the environment, and that helps to calm your mind. Definitely a positive effect is there by a visual impression of environment on your mind, on your brain, and that calms your mind even the noises, the sounds which we hear in nature, that will help to calm your mind, and that helps to reduce your stress. So always try to be in a part of your nature once a week at least. That will help to reduce your stress. Various clubs and its implementation. You can join a club, that may be a game or a playing or even a writing activity, drama activity. Various different activities are there, and you can join with that, and you can have a reduction in your stress. Dr. Venkatesh Madgulkar was a Marathi writer. He says he is a writer of the environment. He writes the environmental stories. He writes on the nowadays there is much conflict between the wildlife and our community. He writes about the same also, and he has written many of the stories on tigers and all that. So he says by reading his book, if somebody goes in environment, he will feel satisfied with his writings. So at least one should join the environment as possible as he can. So it will help definitely to reduce your stress. I'm again showing why education, need of education. So all these factors related to the stress should be reduced. And if they are reduced, and if you go for education to satisfy your interest as well as your likings, it will definitely help to reduce your stress. That what I wanted to stress. So I took this slide again once. And now the importance of stress, how stress is bad, why it is bad. This stress can lead to not only to the suicidal attempts, but before that there are so many things how the stress can affect your body. It affects your body by various things. So the stress, when it becomes a chronic stress, continuously if a person is taking stress, then it becomes a chronic stress. He never goes to environment, he never plays, he never have any art, and that becomes a chronic stress. Every day he thinks about his problems, negative thinking. All this makes the your stress to chronicity, and this chronicity will again lead to, first of all, hyperacidity. This hyperacidity is everybody is facing nowadays. I know the people, they are eating the antacids for since last so many years. They tell, I'm taking antacid since last 5 years, and they are not bothered about that he is taking or she is taking antacid since last 5 years. So this is not a good sign for your body. It can have side effects on your body, but nobody is bothered about. So I think this is very important. Chronic stress has to be released, and if it is released only, then you can be away from hypertension. I have seen hypertensive diabetes, which I was 30 years back. I very rarely saw the patients having hypertension or diabetes, that too above the age of 60. Now, I regularly see a person having high blood pressure and high blood sugars at the age of 30 also. And day by day, this percentage is increasing. And that's why I was worried about this stress in teachers, students, and everybody. This will be the, after even teaching, after your graduation also, no proper career, and then we get these all factors, hypertension, diabetes. Even those who are having career, they are under the stress. If they are under the stress, they can have these problems. So without stress, if you are studying, without stress, if you are working, then only you can get free from many of the diseases or many of the health problems. So hypertension, diabetes, even heart attacks nowadays we see at an early stage. Then hyperacidity, malignancy is also related with stress. The book which I have translated, Love, Medicine and Miracles, that definitely says that stress is a cause for malignancy, and it has got proofs nowadays. People are working on that. how the stress is affecting your body and how it can be converted into malignancy. Again, brain stroke is very common in the stressful persons in early age. I'm talking about early age. I'm not talking at the higher age or after 60, 70 or in 80s. I'm talking about from 30 to 50 years of the age group. So these are the factors which are increasing day by day, and we are worried how to handle these things. The researchers are worried how to handle these problems, and so to reduce these problems, we have to control our stress, control our depression. One can go in depression with a stress and then suicidal attempts too. So psychological problems are also increasing because of stress. So one should try to reduce our stress by all means. So before going to end of the lecture, I would like to remind you, take home message, please do exercise every day, have one of the hobbies, read the book, if possible write the diary in the evening so that you get relieved of your problems. If possible, have a prayer at the bedtime so that you have a good sleep at the bedtime. And if possible, be happy, be positive thinking, and that will help to reduce your um, stress. Somebody had said, even Sant Kabir had said, I can say, सुख में दुख में सुमिरन सब करे, सुख में करे ना कोई, जो सुख में सुमिरन करे दुख काहे को होए. अगर हम लोग रेगुलर प्रेयर करेंगे, इफ वी आर डूइंग प्रेयर एवरी डे, अगर हम एवरी डे इफ वी आर praying our God in any form, that will help to reduce our stress by, because if you are doing it regularly, even when you are happy, you will not get दुख आपको कभी नहीं होगा, ऐसा कहा है. और इसीलिए हम लोग सभी सुख में भी सुमिरन करेंगे, ऐसा सोचती हूं मैं. एंड आई विल ask everybody to do that. And thank you for listening me. Thank you, everybody.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Thank you so
Thank you,
much,
ma'am.
ma'am. Respected faculty members and dear students, I sincerely express my heartfelt gratitude to our extreme resource person, Dr. Shubhada Lohiya ma'am, for delivering such an insightful and meaningful session on the stress management for the teachers and students. Her guidance, practical tips, and motivating words have truly helped us to understand the importance of mental well being in our academic and professional lives. I would also like to thank our respected organizing committee for constant encouraging and supporting organizing such valuable sessions. My sincere thanks to all the faculty members, organizing committee for their active participation which made today's program a great success. Once again, thank you ma'am, and thank you for giving your time and your guidance. Thank you ma'am.
Thank you. Thank you so much to all the organizers and all the listeners. Thank you.
Thank you, ma'am.
Mhm. I will go to my next lecture.
Yes, ma'am.
Yes, 1 minute. I'm sharing my PPT. Can you see my screen?
Yes, ma'am. Yes, ma'am.
Yes,
Yeah. Yeah.
Yes.
The next topic is health and healing, the role of medicine and psychology. We have already discussed much more part of the psychology in last lecture, but there is the importance of medicine too and psychology too. Both the things are required for health and healing. So how one should get medicine and how should go through the psychology, that I will be trying to discuss with this topic. My first part will be how to define the health. How we define our health is, many times we define health, that is illness, to get rid of illness, but health is not to get rid of illness. WHO has defined the health as a state of complete physical, mental, social, and spiritual well being, and not mere the absence of disease or infirmity. So it's a very important part, that is, one should know a proper definition of the health. So it's not just a physical part that you are good, your joints are not paining, your headache is not there, your chest pain is not there, or you don't have a fever is not just a good health. You should be stable with your mind. You should be social enough, whatever we have seen in the previous lecture. And they have added in last few years about the spirituality of a mind. So that is a very important, the spirituality that works with your positive thinking, and that should be there every time. So that will help you to have a proper disease. Health is associated with well-being rather with diseases. Somebody had said this, and this is a very important thing which is to be done by everybody. When we go through the mind and disease, the book Love, Medicine and Miracles, uh, which is translated by me, that also says that mind has got very big role in healing your diseases or your health part. So whenever we want to heal our disease, what should be the role of mind and what should be the role of medicine is a very important thing. Endocrinologist from 19th century, Hens Sele says, all I can say is, to most physical illnesses are largely due to the combination of the body and mind. Means separately, you cannot separate your body and your mind for a disease, for a physical illness. Both togetherly act to repair your body. American psychiatrist George Williant had also represented that factors of satisfaction. He found that people who live with satisfaction in their life, they have only 1 in 10 chance of serious illness or early death. Whatever he wants to say, that the persons who is not satisfied, factors of satisfactions are very important, and the satisfaction level, if it is good in your life, you have a minimum chances of serious illness like even cancers. So that is a very important thing, and one should know about it. We always while when we are having any health issues, we become anxious, we want a early relief. Nowadays, because of Google, it is very matlab, anybody who comes to me for his problem, even a small problem like mouth ulcer or fever or rhinorrhea, rhinitis or sardi, what we say is, he wants that he should be relieved within hours. It is not at all possible. One should be calm with mind, should not be anxious to get relieved of his problems, but if he becomes calm, he will get early relief from his illness. So that is a very important thing. Now, suppose you have a disease, how to manage it? How the management is done? Medication is very important. First part is always medication. I will not say that medication is not important, but many people, they try to avoid the medications. Especially, I have gone through the patients who are having hypertension or diabetes. They don't take their medications properly, regularly, and then it increases the burden of pills. Also, it increases the burden of mind and health issues too. Then they have to manage their eyes, their kidneys, and all that. And then we can't do as a doctor to make relief from his disease. So medication is an important part. Please listen to your doctors about the medication and do with that well. So it will be definitely a helpful thing. Then many small elements are not always to be treated with medicines, like I said about mouth ulcer, or if you are getting a fever, try to understand why your fever is. If it is a early stage of your fever, it can be relieved by your body. Your resistance power is ready to fight with that. Try to try to increase your resistance, and that will help without medication too, to get relieved of your small elements. You should not take medicines for that. Many of the people, they want, if they have a cut on their hand, they will take medicine to avoid the infection and all that. It is not at all necessary. A cut on your body or part or a skin will be healed itself. That doesn't need any medicine. Just take care of that, and you will get healed that wound. Needs mental support of the family. Suppose that is related with the stressful disease. Member, I definitely try to call. I tries to call his family member with his mobile. I tries to take a number of his family member, and then I try to call the family member, and that family member supports mentally to him, and because of that he get relieved of his problem as early as possible. Mind support by doctors and himself should be there. How a doctor, when he tells about the complications of the disease or aggravating factors about the disease to the patient, then patient is always worried. Try to, first of all, a doctor should first try to calm the patient. Even a patient should get mind settled first of all. He should not be anxious enough what will be the next issue and how should I get relieved. Please give yourself to doctor properly and ask him to do properly without any queries, without any confusion in the mind. Have a faith in him, and then you can get relieved of your problems early. Regular exercise, that also help for the diseases. If you are exercising regularly, you will not get stress. That already we have seen in the last lecture, and that will help to be away from the diseases or disorders. Avoid overexertion too. Many of the people I have seen nowadays in IT also, and nowadays in teaching skills also, I have seen that many of the teachers, they do so much work, and the students too, they have to work so much. They want to complete their submissions within time, and so they do the exertion mentally or physically, whatever they have to do. Even in agricultural field nowadays, exertion is more, and this increases the health issues. So please get satisfied with minimum requirements and avoid the overexertion. At least when you are ill, you should avoid the overexertion. That is a very important factor to your body, and that helps to relieve from the health issues early. So avoid overexertion. But once upon a time, overexertion that can help you, but always continuous overexertion will definitely go to the illness. Positive thinking is a very important thing. Think positively. When you have got fever, I have seen advertisement that after seeing a machar, a das, a person is thinking that he will get dengue and all that, and then admission and then emergency. That was an advertise. It's okay. But if you are thinking in that way, you will not be away from the illness. You should think positively how to handle the problems, should be the conditions, and then you can get positive outcomes too. So that is a very important thing to manage a disorder or a disease. I'm talking about all these factors because with medicines, these all, if together are there, you can have relief from your illnesses and you are a happy, healthier person. Sports for chronic diseases, definitely it improves your disorders. Sports are very important. That makes you to have a positive thinking, that gives you regular exercise, and it will help to be healthy enough. Yoga, same thing is there. Regular yoga will definitely improve your health, and that helps to get relief of your health issues. Role of medication is very, very important. One must have opinion of a doctor, preferably a family physician. I will emphasize again family physician, because we have got many of the super specialized persons nowadays available. If you have got chest pain, you go to a cardiologist and he will go for your angiography, angioplasty, everything. But really it is needed or not, a family physician is knowing you. He knows about your personality, he knows about your nature, he knows how anxious you are or how satisfied you are, and he will advise he will guide you properly, whatever is a need. And then if you go for a consultation of super specialization, that is a very, very good thing in your life. Otherwise, many people I have seen just having headache, and they have come with all investigations done to me at the last phase, and then says ki, now what to do? Nothing is to be done now. Just counseling is needed. So if counseling is done at the first level by family physician, then no need of other investigations. But already the person comes with all investigations done, then family physician cannot do anything. So first of all, go to your family physician and then get investigated as per requirement. This is very important thing. While you are having health issues, please do this. Proper diagnosis and investigations that a doctor will do, but even then, some patients, they themselves insist that, madam, please do my sonography. Madam, please do CT scan. Madam, please do MRI. So that should not be there. Google is there to help you, but Google should not monitor you for investigations. And that is a very dangerous thing, because then you will not be happy enough. Your anxiety will increase, your mind problems will be increasing. So please don't do it. Go to your family physician, get a proper consultation, do the required investigations or required diagnostic tests only. Don't go for many tests and then come to dongar pokhrun undir kadla, like that. Don't do it, please. Regular medication. Whoever is having a heart problem, diabetes, kidney problems, or hypertension, those should undergo with a regular medication. If you stop the medication in between, then definitely your problems has to be increased, and you will require more and more medication, and more health issues you will have. Don't miss the instruction regarding medication. I have seen the patients when I tell them that this medication has to be taken twice a day. Then they go to home, again come after 10 days. No, madam, I have taken it for once a day only. Why? Because I have listened like that only. You told like that only. I have not told like that. He also knows it, or he has not privileged listener that how to take medications, so he doesn't listen my instruction. Please don't miss the instructions by your physician doctor regarding medication, and do whatever he has advised in that way only, in that manner only. Please don't miss the medications. Ask your doctor about every medication. Suppose you have got the prescription of 5 medicines. Please ask every medicine for what purpose this medicine is, so that you can understand really the need of that medication or the help of that medication, when it is there, how it is there, and that will help to improve your faith, improve your belief in the doctor also, and medication also, and that will help to get relieved of your problems, health problems. So it is very necessary to know about every medication which you are taking for. Avoid necessary supplementations like iron, calcium supplementation in pregnancy or even in other disorders. Nowadays it is a practice that every pregnant woman is given iron and calcium and many more. I will not list here what they are receiving, but one should think in a way that really a pregnant woman who is having a good diet, who is having a good family support, who is having a good economic support, why she should have a supplementation from outside. Her diet is good, she can maintain her diet, so don't take such inorganic things to you. Don't give such inorganic things to your child. Try to get the food from your try to get these elements from your food, and make sure that your diet is good. Don't have such medications which are supplementary medications. Please don't do that, because that will not help. It is going to hamper your life by artificial molecules, which will not give the results within few days, but it's a long term effect on your body and baby too in a
Your
pregnant
email
woman.
didn't this happen. You change your password and authorize again. Please recommend.
Avoid necessary investigations, unnecessary
Thank you.
investigations. In COVID, it's not long back. We have recently, through the COVID era, it was there. Everybody wanted to get his CT scan done, and that's why there was a rush in the hospitals. But I have seen that those people who were not requiring CT scan were also emphasizing me that do my CT scan and go ahead. When it was declared that one CT scan is equivalent to 300 X-rays, then people started to understand the side effects of CT scan. So don't do unnecessary investigations. If required, you have to. But if it is not required, don't emphasize a doctor to do it, or don't. And you can ask a doctor whether why it is necessary, and then only go for that. Okay. Role of psychology. Role of psychology is fear is a big enemy of everybody. If you are afraid of your disease, if you are afraid of your health problem, even a small fever can change into a severe disease. By suppose we have example of dengue. If you have dengue, if you have got a count of platelet 1 lakh around, and you have a fever, your count will be lowering, and you may need to have transfusion of platelets. But if you don't have fear, you are not afraid of the dengue, you can face it very well with a calm mind, without fear. The platelet count will not go down, it will not lower, and then it will improve as early as possible, and you will get rid of your fear. Suppose a person is advised angiography and he has got fear in his mind about angiography. What happens? He's confused whether to do or not to do. Or suppose we have consulted two doctors and one is saying that you should go for angiography, the another one is saying there is no need of confused. So try to understand in such situation, please listen to your body reflexes. Your body is a very good communicator to you, your mind, your brain, and with that you can relieve your confusion, and whatever thing is satisfying your mind, please go with that and lessen your confusion. And if your confusion is off, you can do whatever is needed, and that will help you definitely. Treatment with considering all the factors, that is socio-economic factors also. Suppose you are treating a person with the higher treatments, and if he is not able to pay for that, then it will be increasing his worries, and because of increased worries his disease is not going to um, uh, his treatment will not be effective, and he will be not improving from his disease. So one should consider all the factors, talk with the patient.
You are not audible, ma'am.
Now, am I audible now?
Yes, yes, ma'am.
Yes, ma'am.
Net issue was there. Internet was lost. Every time the best expectation will never be helpful, because the best is how to decide a best. Always anything you choose, there will be a thing that is better than it. So best is not the expectation. Please go through your socioeconomics, your mental status and all that together, and then choose the treatment. Expectations will always not be helpful. Sometimes it may be helpful, but always it is not at all helpful. Please try to understand your mind status, your socio-economic status, and then go for the treatment. This psychology will definitely help you to heal from a disease with the treatment available for you. Faith and belief is the very important thing, which basically that is the best thing which can improve the healing by whatever medicine you are receiving. So faith and belief is very, very important. Your faith in doctor, your faith in medication, and your faith in yourself will help to be relieved from any disorder, any big disease, any chronic disease too. I have seen many of the patients who have overcome their disorders by faith and by belief, not by the good medication or good things. So that is a very important factor when you are treating with a disease or disorder. So please have a good faith and good belief in your treatment, in your doctor. That will help definitely for your treatment and all the factors you need. Doctor-patient relationship is a very important factor. First of all, doctor and patient both should have faith in each other. Means if doctor is not having faith in patient that he is following him, then it is also not helpful for the treatment, because doctor will treat without involvement in the patient. As I know what I do when a patient has not faith in my treatment, I will also be not much confident about the treatment, and that doesn't help to the patient. Even patient has had to be faith in doctor. Then togetherly it works to relieve from a disease, relieve from a health issue. It should be fair and should be unprejudiced. Anything which is, suppose a patient has got fear in his mind that no, this thing is not going to help me, and he knows that the treatment will not help me. So in such situations, if he is prejudiced, you are giving the same treatment, he will never get relieved from the problem. So unprejudiced has to be there. आपके दिमाग में जो भी कोई प्रिजुडाइज्ड बात है वो निकाल देना चाहिए. उसके साथ वो निकालने के लिए द डॉक्टर शुड हेल्प एंड इवन अ पेशेंट शुड हेल्प, एंड then it becomes a fair relationship with each other, and that fair relationship will definitely help to the patient and to relieve health issues. It should not be just a business. Doctor patient, if a doctor is treating like a business, he is my patient, I will give him medication and all, I'm not bothered about whatever the further things are will happen. Or a patient is coming like a businessman, I have paid for you, please give me the treatment and all that. It doesn't help. We have seen nowadays the attempts that have taken place. मतलब जो डॉक्टर को मार जोड़ होती है वो इसी कारण होती है कि वी आर गोइंग थ्रू दिस बिजनेस. कंज्यूमर लॉ प्रोटेक्शन एक्ट इज द very false belief that doctor will treat us in a good way. If you have faith in each other, then only it is going to be a good treatment for the patient and for everybody. It has to be with cheerful atmosphere. The atmosphere in the hospital has to be cheerful so that it helps for healing. The atmosphere in the family should be cheerful around the patient. It helps in healing. So cheerful atmosphere is a very needed thing to get relief from your disease issues. That is a very important thing which is never taken care of. Many times I have visited my patient's home, and the atmosphere at the home is so परेशान रहते हैं सब लोग आजू बाजू में, और बिल्कुल चेहरे पे जैसे ही कोई मौत आ गई हो घर में, इस तरह का एटमॉस्फेयर होता है. और दैट विल नॉट हेल्प अ पेशेंट. यू शुड बी cheerful, your atmosphere should be very helping. Even in hospital, same has to be there so that patient get relieved of all these problems. So how the mind helps in healing? Be stressless. So how mind will help means how mind should work for healing. Stressless, how you will become stressless? So communication, proper communication and between doctors and patients is very important. Never a doctor should suppose a patient has got a query, please try to understand his query and solve his query so that a proper communication will help to be less stress, and that will help for healing. You can make the stress less by touching a patient, having you can tap on his back. You can have, if the patient is lying down, you can put your hand on his head by a doctor or a patient's relative also. This helps in healing better, and that is very important. A touch is very important for healing. A communication is also very important, and this is not only by doctor or a patient, but with relatives also this is needed, and that helps in healing. Meditation, it definitely reduces your rage, and if your rage is less, your body is relaxed, and your body is relaxed, it will help to have the effect of medications very nicely on your body, and that helps in healing. Improves this also, meditation also improves your parasympathetic responses in the body. Parasympathetic is the system in your body, it's a neurological system that helps to make your mind satisfied, calm, peaceful, and that helps in healing indirectly. So it is very important that you should meditate on a factor. Self-esteem. Accept yourself as you are so that you don't get any health issues. If you don't accept that myself, I forget something. Oh, okay, you forget it, accept it that I am a forgetful person, and go ahead. You will be helped by the community as well as your family, and you can do so many things with confidence because you have accepted your deficits, and that will help you to overcome the many of the issues, and that keeps you healthy. Always be determined and try to become independent. Don't be dependent on somebody. What we do in our family, that old age patients which are in our family, we ask them, don't do something in house, don't do this work, don't do that work, and it then these old peoples become deceased, or they get some problems and they are not independent. Every time we ask them, I will give you at your place everything, that will not help them. Make them independent, let them do their all the things their self, and you will see that they are relieved even from heart disease, from heart failure. I have seen the patients, they get relieved of such a big problems too by making them independent and making them determined. They they get relief from the severe diseases too, and they work very well for a longer duration. Death, accept the death. Death is a truth. Never think that death is a failure of a doctor. Even a doctor should not think that death is his own failure. Death is a truth. So accept it in a proper way. But what we want to do is never think if we would have don't done something. जैसे we can see that many people feel like that कि I have been to that doctor or that specialized probably, or that treatment would have helped me and our patient would have been survived. But that is not the thing. Death would have occurred after some time and it will be there. Please accept it. Don't say zer, ter, or if and buts. Always think that a death should be easy and smooth. Try for a smooth and easy death, not to avoid the death. Always, avoidance of death is never a healthy thing, but making death easy and smooth is a health, basically, because death is a truth which we have to accept it, and if we accept it, we can make that death easy and smooth. Treatment is done by medication. Always, we have seen, we go to hospitals, we get medications, and we get treated properly. But healing of our body, healing of our mind, healing of our body is done by mind. If your mind is positive, nobody can keep away you from the healing. Though you have got some physical problems, you are already healed because your mind is healthy, and your body will be healthy if your mind is healthy. So treatment with medication is necessary. Along with that, if your mind goes, your healing will be very good. And so one should go with your mind positivity. I have already discussed how to avoid the stress in the last lecture, and now I want to all consider this stressless life, your satisfied life, your cheerful life, and that will heal you from any disorder, any mental, any physical, any disorder. And so healing is done by mind, and mind role is very important. We can get a good treatment in a good hospital, in a big hospital every time, but we cannot gain your mind support. That has to be created by ourself only. The mind support is to be get by family, by some himself. Self-esteem has to be there, and all these factors together only healing will be there. So one, if we want a good healing, if we want a good health, so it is necessary that treatment should not be done only with medications, but along with the mind involvement, along with the self-esteem, along with the satisfaction, along with the communication, touch, all these factors will help to heal our body, and then making our body healthy. And the definition of the health, which we have seen, that spiritual, mental, physical, all health will be good if it is done with our mind at our mind level. So please always keep your mind positive and get a healthy life for all. I pray that all of you should be healthy enough in your future life. And thank you for listening uh, me, and thanks everybody who is attending this lecture. Thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Thank you, all of you.
Thank you, ma'am.
Conclusion session. As we come to conclusion of today's session, I take this opportunity to express my sincere gratitude to our extreme resource person, Dr. Shubhada Lohiya ma'am, for conducting such an enlightening session on the stress management for the teachers and students, as well as on the second session's health and healing, the role of medicine and psychology. Her session beautifully emphasized the importance of mental well-being, emotional balance, and holistic approach to the health by integrating the medical sciences with the psychology. The practical insights, real-life example, the motivating guidance shared by her have truly enriched all us and will surely help us in the both our personal as well as professional life. I would like to extend my heartful thanks to our respected faculty members for constant supports in and our also organizing committee for their support and cooperation. As well as I also thanks to all the participants for enthusiastic presence and active involvement. Once again, thank you all for your valuable times and cooperations. Thank you. Thank you, ma'am.
We are teaching. We are teaching. How am I doing? And this is participant.
यस, थैंक यू ऑल पार्टिसिपेंट। अभी आपको आफ्टरनून सेशन 2:45 को आपको ज्वाइन करना है, ऑल पार्टिसिपेंट।